This is a Cavalier King Charles Spaniel that has presented with severe caudal mucositis, more severe caudally but extending on rostral, and had the traditional cups lesion adjacent to the maxillary canine teeth. If you look a little closer here at this image, you'll see this unusual structure here on the palatal mucosa, and here is the lower right mandible, the severity of the inflammation here. And when you see this in a Cavalier King Charles Spaniel, they traditionally have two diseases which can concurrently exist, and this is cups or contact mucositis in addition to eosinophilic granuloma. And the treatment for the mucositis and the cups or the chronic ulcerative periodontal stomatitis component is extraction, as it is in any breed. But as far as eosinophilic granuloma goes, the treatment depends on the severity and whether the patient is actually painful or if these lesions are physically causing pharyngeal partial obstruction. So we've had these where we've removed them surgically just because they're so massive that we wanted an immediate fix, and all the way to the other extreme where we do nothing because the lesions are minor, and during a wake exam we can touch those lesions and the patient doesn't respond with a pain response. So the in-between for this problem when it occurs in dogs, and again you'll see it commonly in Cavaliers, is to treat with prednisone at the lowest effective dose that eliminates any clinical signs. And by clinical signs I mean ideally palpating those lesions and not getting a dramatic pain response where the patient tries to pull away. And certainly you have to test that on normal mucosa first to kind of get the reaction, and in so doing also kind of desensitize that patient to that manipulation, and then go back to the lesions and touch the lesions and create a similar response, and you know you're probably not dealing with a painful lesion in that particular patient. On the other hand, some of these guys are overtly painful. They don't eat. If they have even the eosinophilic granuloma by itself, which tells us that many of them are painful, and so prednisone is a treatment of choice for these. Cyclosporin has been used, but it's less effective, and so prednisone, ideally getting to an every other day regimen and using it off and on is the way to go. And some of these will resolve totally. Others will be there for life or need to be treated for life. And there's the patient after treatment, and you can see how nice all of that's resolved. You can see right there we still got a little bit of a lesion there, and a little bit here and a little bit there as well. So not totally resolved, but in this patient, just getting the teeth out that were affected minimize the inflammation adjacent to the lesion, so that can be helpful if the two are coexisting. Here's another patient. This is a greyhound with a very diffuse stomatitis, and this is quite unusual. We don't see this very commonly. Anytime you see something unusual like this, you want to biopsy it. So this patient also had splenomegaly, and we biopsied, and this was systemic lupus erythematosus. And the only case I've seen with this, but we've seen quite a few named immune-mediated diseases associated with stomatitis, so you must always have that in the back of your mind. You must always rule out these named diseases because you wouldn't want to go in extract all these teeth when you're going to be immunosuppressing this patient anyway for the disease, which will probably resolve this local portion of SLE. So that's what we did. This patient went on azathioprine and prednisone, and prognosis for this long term is not good for the patient as far as the systemic manifestations of lupus in many cases. And this patient was euthanized a year and a half after the initial presentation, but did quite well with therapy. And again, this is before, another image before, and then that is after treatment with the prednisone and the azathioprine.